Periscope or
no?
So,
okay.
Yeah, okay.
So the question again?
Yeah.
Okay, so in Sweden we've had a problem because, and we've heard a lot about euglycemic ketoacidosis in type 1 diabetics. We've had problems ourselves to find the research or find even case studies about this because I don't know actually why, but it's really difficult to find. And I would like to ask you, with your extensive research background and your extensive clinical experience with people with diabetes, if this is something that occurs commonly, easily, and often.
Well, so having a normal blood sugar, the euglycemia, and in a type 1, so someone who has no insulin inside, but they are injecting insulin themselves outside, right? So in that situation, my training and what I've read and in my clinical experience just doesn't make sense that this would lead to acidosis. So you may have ketones that are used as fuel in the blood, like glucose, and the ketones may go up a little bit, but the process of having acidosis is very different. It's much different. So that with acidosis, you become ill. Your blood sugar goes up, and so you're saying that maybe there's a new problem where the blood sugar is normal, yes, and someone gets sick specifically on a ketogenic diet. I haven't seen it, and it makes no sense to me. So I would like to know if that exists, maybe a case study, or if someone could send me the information at Duke University, I'd love to look at it too. But I'm not concerned. So I have many patients who have type 1 diabetes, and there are many patients with type 1 diabetes who are not my patients, who are doing a ketogenic or low carb, high fat diet, and they do fine. So I don't know where this concern comes from.
No, so basically, I mean, it would, you can easily avoid ketoacidosis as long as you take insulin. Of course, that is the key. You have to still take insulin. Right. And you have to stay hydrated because dehydration is part of ketoacidosis. Right. And eat nutritious food. But is there anything else you would need to do actively to not have this happen?
No, I don't think so. So as long as you're eating real foods, you know, following a reasonable low carb, high fat lifestyle, I could anticipate maybe someone mistakes just seeing a ketone level being high. They might mistakenly think it's a ketoacidosis when it's not. So I would urge people who do check their own blood to not worry if the ketones are up and not call their doctor, who then tells them they're sick when they're not sick. And I mean, you can envision that happening.
Yes,
right?
of course.
Yeah, so I don't think that's going to happen.
But there is one case where it can happen, but that's in type 2s who are taking a specific drug. Right. The newer types. The last question, I promise. What would you advise parents of type 1 kid who come into your office and they are desperate for anything to work? You know, their levels are all over, and they're taking so much insulin and they can't get anything to work. And what would you advise them as a physician?
Right, so learn about what diabetes is, which is the high blood sugar. Learn what foods raise the blood sugar. Learn what good nutrition is. And for me, good nutrition starts with protein, not the carbohydrate. So learning all those things. LCHF, in my experience, is safe, it's healthy, and very effective for normalizing those highs and lows. So I think LCHF is fabulous.
Thank you very much for your time.
My pleasure.